In 2018, 11-week-old Deon Woodeye Jr. passed away inside the Crozal Community Hospital. His parents Leah and Deon Woodeye rushed him there after the child began experiencing severe diarrhea and vomiting.
They never made it take it as an emergency because the nurse, she, from the first place, when you reach the emergency, and if clinic may open, maybe then I'm going there. You understand? But the emergency, and my baby, the cry and thing, and I know you don't feel good. So that's why I carry on there.
We spoke with Dr. Natalia Beer, the Maternal and Child Health Technical Advisor at the Ministry of Health, about protocols in place at public health facilities for emergencies involving children.
A majority of parents know when a child needs to go to emergency. A few cases may slip into outpatient and need to be diverted to accident and emergency. And whenever there is a complication or a person in need of urgent attention, then they would get priority also at emergency.
But that's not the kind of priority that Deon Woodeye says his son was given. The couple claims that they waited 2 hours clinging to their sick child before getting help.
My mind, I don't know where to do that time, and then I made a thing for like try find one next way how I can get my baby get better quick, because then doctors not want me to work out and should have work. And take too long with my baby, then time my baby done, they get blue already.
Dr. Beer says the staff at emergency units across the country are trained to determine when a patient needs emergency care and when a patient must join the queue. This is done to manage the limited human resources available at health facilities.
Let's say a child with a severe dehydration, secondary to diarrhea. Everybody can identify those cases, and that doesn't need no question, no paper. It goes directly into receive care. But other cases that are not that urgent, they will be seen in emergency, but they would have to follow procedures or wait for their turn.
Dr. Beer further indicated that the circumstances that may have led to baby Deon's death are isolated.
That case in particular doesn't happen every day. It's very rare we have a situation like that. And there are sometimes, because the problem with young babies, young children, is that they do not present all the signs and symptoms that you would expect with older children or with adults. So even for clinicians, it may be a bit difficult to, and especially if they are not in the hospital setting, as occurred in this case. It was at the polyclinic, if I'm not mistaken.
Leah and Deon Woodeye sought to take legal action shortly after their son's passing, believing that their 11-week-old son would still be alive if efficient care was provided. The matter was heard virtually by a magistrate and later dismissed. Their attorney is now working on appealing the dismissal.
At that time, the lady, I wish she could have do, start put the baby for IV, or check up or whatever, do a triage, then go and call the doctor. But she never do that. Yeah. I guess she be too busy on the phone.
Like what the lawyer tell we, he said that this case is a winning case, so all we have to do is keep on smiling, but I don't know what kind of smile
we
now.
Smile too long.
I think we smile too long now, so I don't think we are, time they run out, and I don't know what happened. So, and with she sickness, I need a lot of help with she. Right now she need a biopsy, and I need to try to find a donor for she for her kidney.
Turning to another hospital horror, Aaron Allen passed away inside the KHMH on the night of July 8th, 2 days after his mother, Nayomi Guerrero, went to the hospital with severe bleeding. Still grieving her son's death, she questioned many of the decisions that were made at the hospital.
Are you bleeding? They asked again. I tell her no, miss. But they tell you I just urine pink this morning, and obviously nobody urine pink. And then she say, well, you have to wait. There's no emergency anymore. That's why you should have make up fry. Yesterday, for the first time you bleed. I tell her I just want to make do an ultrasound for me to see if my baby okay. She said, you can't get an ultrasound because it's not an emergency case anymore. But if you want your ultrasound, you have to pay for it.
We also spoke with Dr. Natalia Beer about the protocols in place at public health facilities for pregnant women experiencing complications.
Our protocols are designed in a way that the woman have contact with the primary healthcare facilities, and then there are steps that the health facility need to comply with and assess and interpret, and then make a decision to refer to the specialist.
Still, the decision to conduct a C-section came almost a day after she arrived at the hospital.
In the morning when they did wrongs, I finally saw a doctor, right? And they were already monitoring the baby hearts again. And that's when the doctor, when he came and checked me, it was my turn, he didn't came to me and told me directly. He told the nurse, prepare this lady, she needs C-section right now.
According to Aaron Allen's death certificate, he passed away on July 8 at 10 p.m. Guerrero also claims that she did not get a chance to give her child skin-to-skin care after the delivery, an opportunity gone forever.
He born the Friday at around 9:30, and I didn't get to see my baby that day. I didn't see him any at all. So
As part of the baby-friendly hospital initiative, all hospitals are encouraging women after vaginal delivery or even cesarean section to have the baby placed on the abdomen of the mom, or start their breastfeeding within the first hour after birth.
And if it's a premature child?
Likewise, with prematurity, the ideal condition is for the child to be kept warm, skin to skin with the mom.
Guerrero says the greatest toll during her time at the hospital came from the manner in which information was being provided to her. She shares that she was unfamiliar with many of the terms being used, which she says added to her anxiety.
It's always a challenge for us caregivers to be able to break down in a 5 cent and 2 cent in the common language of the person. What that actually means. I mean, it would be ridiculous. I think it would be ridiculous for any caregiver, doctor, nurse, tell the patient that they have one condition when they call abrupto placentae, because what the hell that means. So you try to break it down.
I guess that's a big problem right there at a hospital, because then nurses and doctors should come and explain, you as a patient, you when you have the degree to help you understand, right, what is happening.
Reporting for News 5, I am Paul Lopez.